Welcome everyone. In these upcoming few moments, I would like to introduce you the progress of my PhD work. My name is Dóra Koch, and I'm a PhD student from the second department of pediatrics. And one day I want to be a pediatric hematologist. So therefore, during my work, I want to achieve the best therapeutic response with the lowest possible toxicity in pediatric malignancies. And I'm dedicated to prevent severe toxicity of chemotherapeutic agents in pediatric malignancies. So first of all, we are going through the literature and analyze the data in connection with really frequently used chemo and its administration routes. And after that, we want to strengthen the evidence by performing a protocoled comparative evaluation. And last but not least, we want to fill the gap in the knowledge in connection with a highly investigated topic, late effects of vincristine-induced peripheral neuropathy. So first of all, I would like to introduce you my first project, in which the manuscript has, writing of the manuscript has already been started, and we are selecting the potential journals. So vincristine is a widely used chemotherapeutic agent. It's really effective in hematologic and solid malignancies, and it has a really specific adverse effect called neurotoxicity. And we have to emphasize that these patients, they not only have to struggle from a mortal disease and the diagnosis of a mortal disease, but they have to deal with the adverse effects of chemotherapeutic agents. And these agents deteriorate their quality of life. So for other drugs, we can find evidence in the literature that changing the dosing schedule resulted in less toxicity with the same effectiveness. So this is why we want to compare this in the case of vincristine, so the different administration routes. So regarding to our clinical knowledge, our hypothesis is that when we use vincristine as a continuous infusion, it can reduce the severity of toxicity levels. So this was the search key we used during our systematic search, which we have conducted in 3 different databases. And in the end of the selection process, we found almost 300 articles eligible. But I have to note that these are observational, not comparative studies, because we are lack of comparative studies in connection with this topic. So here in this first plot, here you can see our first results. It is in connection with the overall incidence rate of VIPN, vincristine-induced peripheral neuropathy, in any severity. In the push injection group, it was 40, or almost 40%, 39%. And we evaluated the same outcome in the continuous group, which was 37% in this case. We evaluated the incidence or the overall incidence rate of severe neurotoxicity, which was 6% in the push group and 3% in the continuous group. We performed numerous subgroup analyses, and one of that is the effect, or we wanted to find the difference between the type of malignancies and the incidence of neurotoxicity. So first we made 2 groups, solid tumor group and hematologic malignancy group, and we found that it was 17% the overall incidence rate in connection with solid tumors and 36% in hematologic malignancies. Yes, I just want to highlight it. And we performed numerous subgroup analyses in connection with concomitantly administered agents. And as you can see in the first 8 drugs, no difference could be detected in the incidence of neurotoxicity. But in the case of bortezomib, we could see an increase of neurotoxicity. So, of course, every study has strengths and limitations. We could collect a lot of data from this high number of eligible articles. So we have really detailed information about VIPN, and we could perform a lot of subgroup analysis. And our big limitation is that these are observational and not comparative studies. Preliminary, we can conclude that there is a failing evidence in connection with the administration routes, but we could find a tendency between hematologic and solid tumors. So we can say that there is a trend that neurotoxicity occurs more frequently in hematologic malignancies. And we can say that the investigated concomitant chemos had no significant effect on neurotoxicity, except for the case of bortezomib, which correlates with the data we can find in the literature. And for clinical practice, we can conclude that these chemotherapeutic agents, they can be safely administered with vincristine. And during the analysis and going through the articles, we realized that there is a really strong need for a YIPN consensus definition, because the guideline is needed, a diagnostic guideline to assess YIPN, because it has a great effect on therapy modification. And for that, a sensitive and really patient-friendly method has to be found or investigated for diagnostic methods and severity assessment. And we hope that by modifying the administration route or dosing schedule, the toxicity will decrease. And for research, we have to conclude almost, which correlates with the implication for practice, that a really precise and objective method is needed when you want to report the prevalence or the severity of VIPN. And there is a strong need for protocoled randomized controlled trials. So this is why we are performing one in connection with this topic in children with hematologic malignancies. And so this could be a gap-filling study in which we want to compare the dosing, the pharmacokinetic differences in the different dosing schedules. We want to compare the two routes and the toxicity levels, and we want to correlate our toxicity data with the pharmacokinetic parameters. So this will be a two-armed randomized controlled trial in which on the first, or the arm A, the vincristine will be administered in a 3-hour-long infusion. It will be compared to the conventional push injection form. These are the days when vincristine is administered. First, the pharmacokinetic observation will be done, and after and before and after that, nerve conduction studies and neurological examination will be performed to assess toxicity. So our hypothesis is based on clinical practice that the dosing schedule modification will reduce the toxicity in connection with this topic. And this is our implication also. So the primary investigated outcome is the severity of vincristine-induced peripheral neuropathy, which will be performed by nerve conduction, or which will be evaluated by nerve conduction studies. And all patients will be assessed by the frequently used CTCAE grading guideline. And the secondary outcomes will be other toxicities and therapeutic response or effectiveness. Yes, and the manuscript, the protocol manuscript is almost ready. And last but not least, we would like to initiate a cross-sectional study which investigates a really debating topic in connection with the late effects and prevalence of vincristine-induced neuropathy in children. So just a really short summary and introduce it quickly. So YIPN is mostly reversible, but it can also be worsened when we go with the time. And the prevalence is debating, and we want to examine this outcome and the severity of late effect in children diagnosed with hematologic malignancies who finish their treatment. And the outcome analysis will be performed with nerve conduction studies and the novel approach, Hungarian novel approach, the neurometer, which is a non-invasive device for neuropathy assessment. So, and we will collect data, therapy-related data, retrospectively. So these are my projects and the summary of my project. And thank you very much for your attention. And tough times never last, but tough people do. So thank you very much.
I spotted out that there were some old studies in this first project that you had. Do you think that they would have any effect on the outcomes?
Yes. Thank you for your question. So, of course, the therapy of oncology have improved during these many years. And in these articles, we could analyze a higher incidence of this outcome. But it was not related to when the article was written or was published. It was more related, I think, to the older age group in which they included in this study. And and when we talk about time and improvement in oncology, we have to say that the improvement is more significant in connection with other chemotherapeutic agents in which we've already found some evidence-based prevention method or therapy for toxicity. But in the case of vincristine, we still don't have any evidence-based prevention or treatment, so the neuropathy. So the incidence rate could not be influenced by that.
My question is about your third project, where you have introduced this novel Hungarian neurometer, if I got the name right.
Yes.
So I would like to ask that, was it used in studies before, and in what kind of studies, if you know about that? Or do you have any kind of data available that can be as a reference maybe for your studies?
Thank you very much. This device is a really well-known device used in adult endocrinopathies and diabetic neuropathy. So we have data from them, and the Hungarian scientific room validated this device for pediatric population. So we have also pediatric data, but we will read the first one, or the first ones, who will try this in this specific hematologic population.
You mentioned in your implication that a patient-friendly and sensitive assessment method has to be created and needed. Do you know about any novel methods for this?
Yes, this is a debating topic now in the literature. So vincristine is used since the 1960s, and we still don't have a great sensitive method to assess this. There are questionnaires which are combined with neurological examinations or neurological methods which examines the fine motor and gross motor functions. So the range is really wide and the spectrum is really wide, and a lot of measurement methods are already validated, but they seem not to be sensitive enough to test this kind of outcome or to diagnose at least the YIPN. And there are some more objective methods than questionnaires. For example, there is a device called pseudoscan, which examines, which is already validated also in diabetic neuropathy, but in the UK they are trying to validate it in children treated with neurotoxic chemos. So this is a novel approach maybe, but it is not available in Hungary now.